So welcome everyone. My name is Lily Corey. I use she, her pronouns. I'm a program coordinator at the Center for Children and Youth Justice on programs related to young people who are CSEC and young people who are LGBTQ+ in systems of care across Washington State. This is our second Pride Summer Lunch series, and we are so honored to have the folks from DCYF who are really leading this work, as well as most of you on this call who are really leading this work. And so it is my pleasure to welcome Day Shugren and Amber Salzar. Go ahead and take it away.
Great, thank you so much, Lily. And it's so exciting to see new and familiar faces on this call today. I know that my window is really small, so I can't see everybody, but good afternoon. My name is Day Shugren. I use she, they pronouns. I'm on Kanaka Oi lands here and actually on the Big Island in Hawaii right now. I recognize that my reception can be a little spotty. I also bring you the joy of all the songbirds that are singing behind me, and I hope that's not a distraction for folks. Normally I'm calling in from North Seattle in the shoreline area, so occupied Duwamish and Coast Salish lands. At DCYF, I'm with the Office of Racial Equity and Social Justice. Our team leads the racial equity and the LGBTQIA+ work inside DCYF. So we're really stoked to talk about what we're doing today. Folks who are part of DCYF, I hope that you'll feel welcome to chime in either on the chat to share your experiences with this work. So we don't want to misrepresent, but also just really want to cultivate time and space for folks who are also doing this work alongside of us. So I'm going to invite Amber to introduce herself, and then we'll get launching.
Thanks, Day. Hello, everyone. I'm Amber Salzar. I use she, her pronouns, and I am in Olympia, and I occupy lands at Nisqually, Coast Salish, Squaxin Island, and Cowlitz. I work for the licensing division in foster care continuous quality improvement, and I am the LGBTQIA+ lead for the licensing division. It's also fun to see some familiar faces. Hello, and see some new ones.
Also, secretly, Amber and I are constantly twinning these days. So if you get us mixed up, it's a total compliment. Feel free to do that. Before we get started, I know Amber and I both already did this, and Lily did as well, in terms of recognizing and acknowledging the Native and Indigenous lands that we are on. We want to take the time to honor that now for a moment as well, and recognizing that not only Washington State, but all of the lands across the globe are the traditional ancestral lands of many Indigenous and ancestral lands of many Indigenous people who have stewarded the land since time immemorial, past, present, and future. We'd like to ground our conversation by recognizing these communities of the lands that we occupy, as well as our country's history of settler colonialism, and also really wanting to remember the Black and brown bodies in whose shoulders we stand on that made our country land on the stolen land possible. If you are unfamiliar with the ancestral lands that you are currently on, I know that we'll get a chat and a link in the chat box for you, or a text and a website in the chat box for you if you're unfamiliar with that. Doing a land acknowledgement is just one small way to recognize that the lands that we occupy. So please take a moment to do that if you haven't done so already. Next slide, please. I want to just take a moment for folks who are unfamiliar with the Office of Racial Equity and Social Justice, is to really just talk a little bit about our approach to the work and how we are doing this collectively and holistically as much as possible. And I'm seeing some shares in the chat around the lands you want. Thank you all for doing that. We really want to just envelop and embrace this approach around that it takes not just our head, our hands, but also our heart in doing this work. And we also don't often take time to reflect on those intentions. We know that leading for equity is a skill that requires practice, and that's often in our heads in terms of how we think about things, the literature that we read, the research that we do, the meetings we attend, the discussions that we have, right? But it also, that process can often get stuck in our heads, right? It's like when we are only looking at data and we're not considering the stories that are attached to the bodies that occupy that data, right? So it's also about our hands representing how we do this work, how are we building that connection and those relationships with communities, with families, with our partners, knowing that it's our hearts that actually lead us in that motivation. I think any of us can comfortably say, well, I won't speak for others, I need to be careful there, that many times in doing this type of work, folks are always like, well, you don't do it for the money. You just do it because you love the work you do. And I was like, well, I do it for the money because I need to get paid. But I also, and I know that statement's supposed to be a little different, but I also do it because this is the work that I'm drawn to. This is the work that calls me, motivates me, and encourages me. And if I led with just my heart, I also can't recognize all these other components that are doing this work. And so our team, Yvette Jasper, who's actually joined our call today, Latoya Holmes-Ware, who also does this work with me. This is the work that we're leading inside DCYF, and this is how we're shifting the approach. And so it's not just about the work in our heads, but it also is the holistic work of how we do things. Next slide, please. We're actually going to invite folks. I know that there's about 40 of us on the call right now, and we're just going to start here momentarily. We don't have time to do this across the board, but this is an activity actually that Nicholas and I have done many times in training before. And we're going to invite you into small groups. If you're off camera, highly encourage you to come on camera for those breakout groups. But we want to just spend a few minutes dialoguing, introducing yourself, and dialoguing a little bit about why you personally care about addressing the needs of LGBTQIA+ children, youth, and young adults, and what's one question that you bring today. And I emphasized children, youth, and young adults because oftentimes these conversations are limited to youth, let's say the magical age of 12 to 17, and adults, young adults being 18 to, I'm going to say 25 or 26, right? And we don't spend enough time talking about the littles, right? So we know research continues to show that kids by the age of 3 are able to identify their gender, and kids by the age of 10 are identifying their sexual orientation. Always quick to say that doesn't mean they want to go and have sex with their classmate, right? But it does mean that they're paying attention to who they're attracted to or who they have a crush on, and what that might look like. So, you know, Princess Leia was my first like star crush. And I think she's still just kind of imprinted on me. It was not a Twilight reference, but it kind of was. So thinking about like what that looks like, how are we cultivating those spaces for our kids to show up in their authentic selves, to wear the clothes that they want to wear, to say who they're attracted to. So just wanting to provide some framework there. We're gonna, Lily's gonna help me with breakouts. We're gonna put you in groups of 2 to 3, so small groups intentionally, and we're gonna bust out for about 5 minutes. So just a quick time to introduce yourself, ideally share your pronouns, where you work, those are the easy things, and then taking it one step further. Why do you personally care about addressing the needs of these youth? And what's one question that you bring today? And we'll see you back in 5 minutes. Thanks, Lily.
Breakout rooms are open. If you can please go ahead and go in, that would be wonderful. Again, breakout rooms are open. Checking to see if there's anyone. 1, 2, 4. Making sure everyone has a room. Okay, everyone should have a room.
Thanks, Lily.
Mm-hmm.
And then the link for the framework in the next slide should be in the PowerPoint. In slide 6, sorry, in slide 5.
That's what I have.
That's
Oh, I see. Do you want me to put that in the chat?
Yeah, when we get there. Okay, great.
I unfortunately can't actually copy that. It won't let me.
Okay, let me email it. Let me email it to you real quick.
Can you also email me the Whose Land Are You On link that you referenced?
Mm-hmm.
That would be great.
And your slideshow looks different.
I know, because I have to access my email.
Okay. I wasn't sure.
Folks on the recording, this is the glorious of logistics.
Why will not let me do that? I'm doing this a different way now. Can you hear the birds?
I can. Oh, here we go. Maybe I can. Nope. Oh, here we go. There we go.
I just had to, it wasn't.
Okay. I have I was able to get it because I went out of my presentation mode. So here we go. From current slide. The racial equity and social justice framework is now in the chat.
We might have to
Yeah,
post
I'll
it,
redo it, but I just
yeah.
needed the link to be available.
Good girl.
I'm gonna give folks a minute
You
warning.
are good.
Warning. Oh, thank you so much
Mhm.
for that as well.
And then can we actually go back one slide for when they come out of?
Yep.
Thank you.
Okay. I'm gonna go ahead and close the rooms. Welcome back, everybody. Welcome back. Welcome back. Welcome back. Welcome back. We're just waiting for folks. Some breakout rooms are closing in 20 seconds. So, and then we will continue with the presentation. Okay, Day, everyone should be back.
Oh, I want to go back
Thanks,
to my.
Lily.
They were so nice. I just love them.
Oh, Deontay. Hook up the email contact in the, hey, Don. Hook up the email contacts in the chat. Use the chat to network with each other. This is a great opportunity to do so. Yeah. I don't want to hold anybody back, not at all. So because there's just enough of us, I don't want to unmute. I don't want folks to unmute, but if folks could share in the chat a little bit about what they shared in their breakouts, that would be great. Just to get a couple ideas coming into the chat. I would love to hear. I think we'd all love to and benefit to hear from what folks they personally care about addressing the needs. And I see the contact info coming into the chat. That's awesome. Or would anybody like to unmute? Raise your hand and unmute.
I shall.
Go, Deontay. Go.
Hi, everybody. My name is Deontay Damper. My pronouns are he, him. I had a great discussion. I can't remember sister's name, and Richard. And we were just talking about making, like, what does outreaching look like to our LGBTQIA community members? Knowing that, you know, it's not just about the youth. It's not just about the young adults. We do, like, it just extends, right? In the spaces of discrimination that is still continuing on in our community. One of the things that we were just honing in on before the breakout room stops was making sure that we're coming up with great resources for all spaces of LGBTQIA and defining them, right? We do know that lesbian women and trans men in the intersections of community, we don't have enough discussions and there's not enough programming that has actually came out for them in the space. So we would love just to see what else is out there. And I just would like to say that I'm just so damn happy to be in this circle today.
Well, that's beautiful. Thank you, Deontay. Anybody else like to share? I thought this was a presentation day, not any interactive. That's all right. We'll launch. We'll go ahead and keep going. And, you know, I always say that too. I'm not going to ask a question that I'm not willing to answer myself. So just as a, just to share too, why I personally think or personally care about addressing the needs of LGBTQIA+ children, youth, and young adults is that I think that, oh my gosh, I can't narrow it down. Because they're super important and kids need a place to be seen and be heard and thrive, and especially in the system that I have inherited with my job, right? We have inherently been discriminatory as a culture, and we have a lot of undoing and redoing to do. And I often think about how many ideas and contributions and relationships and just capacity building that we miss out on because folks are so stuck in their homophobia or their transphobia or their binary limitations, and we all lose out on that. I think about the young people in my life and the little children in my life and the middle and the bigs, like all of them, and I think, what can we do differently that I didn't have when I was growing up? What can we do differently for our colleagues that we haven't done before? And I don't want to say it's a no-brainer, but it just kind of feels like a no-brainer to me sometimes. But we know that intentional efforts need to be made to address the needs of our children, youth, and young adults. So my one question that I'm going to bring today is, what are you going to do to change and do better what we have been doing? Next slide, please. And Amber, I can't see you, so I trust that you will hop in whenever you are ready to add also. So this is, I'm sharing our racial equity and social justice framework again as a foundational piece in terms of our office and our approach to doing our work at DCYF. This framework was created originally in our early learning, which was one of the legacy agencies before becoming DCYF. And you can see in the center that this particular document is focused on race, eliminating race as a predictor of outcomes, right? And oftentimes what we lose in the conversation is that race is also tied to SOGI, our sexual orientation, gender identity, and expression. It's also tied to ability. It's also tied to immigration. It's also tied to gender. It's also tied to class. Like all of these pieces, right, that we can still look towards and know that we need to lead many of our conversations with race and centering and uplifting the voices of Black and Brown folks. But oftentimes we miss all of that, how all of that work is attached to doing this holistic work that we need to do. So the framework is a place to start around our own guiding principles at DCYF, how we're creating shared language across our divisions and offices, and how we're looking at those theories of change to not only normalize, but also to operationalize racial equity and social justice. And so Lily's dropped the framework in the chat. I'm gonna just give that to you all to look at in your own time, and just, again, wanting to name it and identify it here. Next slide, please. So what are some of the things that we're doing inside DCYF? That's why I think we've invited you all to have lunch with us today, is these are some of the projects and pieces that we're working on. Historically, I know, I'll be the first to admit, and I mentioned it before, that our systems, since they were created, have always worked with LGBTQIA+ children, youth, and families. However, we haven't done our due diligence to intentionally support, resource, and uplift those who identify, or create spaces where those who might be questioning or afraid to come out for a whole myriad of reasons or exploring their identities have been able to feel like they can come out and be supported. So here are some of the pieces that we're working on. Right? So we are really focused on youth and young adult engagement. I'm intentional here, not including the littles, because that's a whole nother ballgame to try to get into. We're starting that conversation. But how are we engaging our youth and young adults at the center of the work that we're doing? Our work will not move without their voices. And so that includes youth who are either currently in child welfare's foster care system or alumni of care, and also our youth and young adults engaged in juvenile rehabilitation services. We've partnered very closely with DCYF to implement the Equality Protocol for Safe and Affirming Care pilot. We started that about 3 years ago. We have 3 active sites that are working on piloting, and actually have recently made a decision to pause the piloting so we can just work on going live and implementing the pilot across our child welfare system, and working closely with our adolescent programs division to also look at how we can develop and support the pilot, not even want to call it a pilot, the protocol in that work as well. In my previous position, we created LGBTQIA+ leads inside child welfare, where my position was based. Now, as an agency-wide position, we've actually been able to expand those leads to reach across the division. So we have, Amber's a great example of course, we have leads in licensing, but we also have leads in early learning, the Office of Tribal Relations, our Family Supports Division, Juvenile Rehabilitation, and this is a newer group, so I think I've forgotten one, but you can see that that's really trying to look at how this work impacts us across the divisions and how these works lead into and work closely together. And one of the big pieces that we're working on currently is our administrative policies. So our racial equity and social justice policies are considered Chapter 6 policies. And we recently, in April 21st, went live with actually our, I call it the mother policy, the racial equity and social justice policy. And we're currently in work groups to develop our administrative policy for supporting LGBTQIA+ children, youth, families, and staff. And so what that looks like, currently we have the policies in child welfare and JR, and I think I actually talk about this a little bit later, but we're actually going to create one agency broad policy and then work on procedures as they're unique to different programs. We also externally, our work, of course, is not limited inside DCYF. We are codependent on other agencies and other systems to do this work together. So we have, as part of our LGBTQ+ work internally, we have an LGBTQIA+ advisory committee. There are a few folks on that committee who are on this call with me today. We also, DCYF has joined the HHS Healthcare Authority Sex and Gender Identity Work Group. That's really been focused on the medical community, but on looking at training and documentation and data and supports for LGBTQIA+ folks accessing medical care. We're an active part of the Rainbow Alliance and Inclusion Network, RAIN, which is the statewide BRG, and also part of the Washington LGBTQ Commission subcommittees. And so those are just some places where we're tapping into doing the work, engaging with it, and always looking for new opportunities to expand that. Next slide, please. Training is a big part of what we also do. I didn't specifically call it out here, so been providing training to staff quite often. And in my former position as child welfare, and now with the Office of Racial Equity and Social Justice, providing it agency-wide. It's really quite fantastic to provide training and see and watch and hear people's stories of ahas and growth, and this is something I can do better, even if it's something as simple as like, I'm going to put a sticker on the back of my phone now, Day. Now I understand kind of better what that means. Or I'm looking at Lily's space there, and I'm like, I'm going to hang a picture on the wall behind me when I'm Zoom calling so my youth know, whatever that might look like. But our content for training includes talking and centering a little bit around privileged positionality. So again, thinking about leading with race and those conversations we have about race and ethnicity that oftentimes people can do a quick like, well, we have to do that work, which we do need to do that work, but they forget about the positionality they might experience being cisgender or being cis-presenting, and what that might look like and how that might show up. So really low accessible examples are going to be like, can I bring a photo of my family to work and put it on my desk if I am partnered with someone of the same gender? If I need to use the restroom and I identify as trans or non-binary, am I going to be able to use the restroom safely? Those are places where identifying a cis or presenting a cis can be very privileged and overlooked, if not framed kind of in that broader context of how positionality shows up. We also, sometimes I'm able to have a co-trainer with me, with somebody who's a young person with lived experience, which is always like the best training ever. Not always, and so I'm able to use direct quotes from young people, often from CCYJ's listening to their voices report, and hopefully Lily can drop that in the chat as well, because we really want to bring those voices forward, because the training really is centered around what they need. Data is also critical. Our data is often tertiary, because as you can well imagine, young people do not want to tell us their SOGI identities if they're LGBTQIA+. So how do we work with the data that we have that exists, and how do we create spaces that invite young folks to do that? And that's part of where that equality protocol comes in. We talk about definitions because people are still wanting to know what the acronym stands for and what the nuances are, and we always know that language is changing, so that's never an exhaustive list. I don't think it would ever be an exhaustive list. My son gives me permission all the time to talk about him, so I'm going to do that now really quickly. So he's 13, and this year he joined the GSA at school via Zoom, of course, like so many, and he stayed remote for the school year, but he came down probably about 4 months ago, and he was pissed at me. And I was like, I was literally just kind of like doing my day at work. And he was like, Mom, I just told my friends about the work that you do. And I was like, sweet, how we doing there? He's like, well, one of my friends identifies in a way of a term I've never heard before. You never told me about it. I was like, well, that's because I'd never heard of it. Can I ask you what the term is? And maybe we could do a little bit of, research on it, or asking about it, or can you ask your friend more about it? And if they're comfortable sharing, he's like, no, we already figured it out. I just don't understand how you didn't know it. I was like, well, because I don't, right? We're generationally different. Like, I'm not in your space with you. I did get schooled that day. I'm all good with it. So, definitions is a place I think I find staff are really like, if I know these words, then we'll be fine. And I'm like, it's a start. If you know the words, it's a start. And the best part about knowing words is knowing what you don't know and being willing to ask, like, hey, that's a new term. Is that something you're willing to tell me more about? Or shall I go do the magic Google or talk to somebody I know who might know? Like, how do we do that? We also cover RCW's facts and policies, because those are things that move into place. And then creating affirming environments is always, always, always at the core of our conversations also. And then resources. And this is a really great opportunity for me to ask you all if you have resources. And I know Deontay kind of threw that out in the beginning too, resources that you think our young people or staff or caregivers or people could access that we aren't accessing. I would love to hear about them. I think this is one of the best ways. So many small things pop up and we can't track them all. And I often think about resources and spaces specifically for BIPOC children, youth, and young adults. It's always a great one to have, and also to ask about space for littles, because so many of the services that are accessible are for 12 or 13 and up. And kids who are under the age of 12 may not have the access the same kind of like support spaces or groups. There's a few around the state, but I'm just going to throw that out there as an ask. How are we doing out there?
You have a question in the chat about what was the term? What was the term that you learned together with your child?
It was gray gender. That was the term, right? And I have heard it one time before in a training like years ago, and so my instinct, of course, to be like, I'm not thinking about this right now, and it wasn't a term I had used. So thanks, Amber. Yeah. Mm-hmm. But now he schools me. I've got new terms. I can't remember all of them either. People are dropping stuff in the chat. Yes. Keep them coming. Thanks, Nicholas, for the use maps. All the good things. All right. Do I hand it over? No, not yet, Amber. Almost there. One more slide. So this was, I mentioned the LGBTQIA+ Advisory Committee. We currently, as I had mentioned, we were focused on child welfare, and now we're expanding to be a broader advisory committee, especially to include our juvenile rehabilitation folks. This is the current mission and vision statement, which actually we're voting on Thursday this week, because we know that needs to be some changes to it to be more inclusive of the broader work. And if folks are interested, I love doing this. We meet every other month on the third Thursday of the month, except August. I moved it because I'll be on vacation, so we're meeting in September. But if folks are interested in joining, come one, come all, like we'd love to have you and have your input. And we just meet for a couple of hours, but we're actually in a really transformative place right now because we've expanded the advisory committee in terms of how we are looking at the work and how we need to do it differently. So I'll pause, hand it over to Amber, and Amber, I'll check the chat for you.
Sounds good. Thank you, Day. Lily, could you bump it forward one slide, please? Thank you. All right, so it's helpful to understand the laws that are applicable to LGBTQA plus children and youth in the system. And there's some broad laws and then there's some that are more explicitly applicable. So this is kind of like the umbrella effect of like RCW and then Washington Administrative Code and then DCYF policies. So we'll talk through it a bit. But really, like, I think the most like learning I've done around this as someone who is not a lawyer is about the Washington law against discrimination and how it prohibits this discrimination on the basis of sexual orientation, which includes gender identity and expression. Thinking about you, Jamie, and meeting you and considering what you know as well. So there's just always more to know here. You know, when it comes to like our laws and legal precedent and political climate and all the things that play into our society. But let's just move forward to the next one, if you would please, Lily. Thank you. So here is the RCW spelled out here. And I think it's kind of cool to consider, like, when I think of all the projects that Day speaks to and what we've done at DCYF, and like it feels very big. And then I also love how like you bring it back to the importance of like putting a sticker on your phone, you know, throw a rainbow on it, right? And like that inclusive message that we send the children, youth, and families that we work with, and how important that is, like to them, to the people we serve, as well as to staff, you know, like it makes a difference when I hear someone introduce themselves using pronouns. So like, if I'm not a part of a project, I know I can still be having some sort of influence or impacting change at like, you know, a level that works for me. So in June 2021, DCYF, DSH's shared buildings all have gender inclusive restroom signage. We were not going into the office very often, right? So when I went in there and I saw the sign, I snapped a photo and like just like have this overwhelming feeling of, you know, all the feelings, but it's just like it's such a big deal. Okay, so next after the law, we have the WAC. So if we're thank you, Lily. So right now, WAC 1520 provides the most direct guidance regarding sexual orientation and gender identity. I think that we're going to talk shortly, or I'm going to talk shortly about updating the 3 chapters for better supporting LGBTQA plus children, youth, and families. But right now, this is what we have, and this is what we lean on as we move through some litigation stuff. I think that it's just important probably to note here is that like this is for all children, and it's inclusive as it was written at that point, but as we learn more, we do better, right? So if we could shift to the next slide, Lily, the next slide is about the proposed WAC changes that are in the works to better address the needs of and promote culturally relevant service delivery. So these proposed WAC changes, it's probably not the first time you've heard about them. They've been in the works for a while. At first they were paused as we moved through the ledge session, and then they were paused based on litigation. I've been sitting in a meeting this morning about a big WAC package that's moving forward, and the goal is to have them in it. So that's very exciting. And, you know, I personally am just taking it in stride. You know, I think that like I see the progress that we're making, and I have high hopes. And I also am consciously aware of my level of impatience that I have around the changes happening. So, so things are coming, and it's going to be helpful and better support our people. So all people. Okay, next is policy. So the umbrella effect. The 6900 supporting LGBTQ plus children and youth policy for child welfare. There's a little blurb of it here on the screen that I won't read to you. But this policy is, I think I talk about another slide, so I'll try to keep myself on track here. This is essentially just to show you like how like the trickling effects of law, WAC policy, and within DCYF and how we've come together. There's the child welfare policy, and then if you move to the next slide, you'll see that JR also has their policy. And I will just pause to give you a moment. And then let's do one more shift. So the DCYF administrative policy 6.04 draft. So this is going to be kind of like bridging all of the policies that exist and then putting some policies in effect around like the practice that's currently happening, because this is, there's movement, you know, so there's things that are in practice, there's things that live in memos, but this is going to be the general umbrella over our policies as an agency. And then I think maybe the racial equity and social justice 6.0 policy will go into the chat like magic if we put that in the notes, maybe. And then I'm not looking at the chat, but Day, I think you said you are, right? Yeah, you are. Awesome. Fantastic. Okay. Yeah, I think it's other than saying like we have these policies that are in effect and then we have the policies that are happening, I think that, you know, it's important to just like consider the progress and how we're moving through this as a really big agency who have important goals. And it's just such a process. Okay, so next up is the leads. And I know that Day mentioned the leads already. So this highlights their name. So one of the questions about how to utilize leads, I think Day's already answered in the chat. Feel free to take a snapshot of this, or maybe the slides have already come to you, I'm not sure. But these are the agency leads. I'll give you a moment to peruse those. And then after that, we'll shift to the next slide. And the next slide is the licensing division specific leads. So basically what we did in licensing division was borrow the framework that Day put together. I think it's kind of cool to consider that here because you're all from different spaces. And so like if this idea resonates with you, like it's doable, you know, it's something that I think it's been really useful for our staff and partners because it gives them a point of contact, a connection, if you will, you know, within their office, whether it's locally or a little bit closer to them. Some of them are familiar faces. So these leads are responsible for working with our department on practice and policy. They provide case consultations, they promote trainings, they share resources. They are involved with debriefing, and I think I already said staffing, but they're really just they're the dream team, you know, they're the ones that are like shifting this work forward, and it takes all of us, right? I think about something I read recently around like the trickling effects of like people's agendas and how the impact that you have, and maybe you aren't even aware of it, but this is us, right? This is all of us doing this work. And I hope that was a long enough. Oh yeah, go ahead. I was going to say, I hope that was a long enough water break or something for you, Day.
No, it's good. It's good. Now I was thinking about one of the questions that came through in the chat are how can the leads be helpful to external stakeholders is how I'm reading that question. And I had put in a response to there around, you know, helping. So Amanda Finney, I see you on the call and have a relationship, so I can pick on you a little bit. So Amanda's at Community Youth Services. So if she is having trouble navigating, you know, maybe a DCYF process or a shared kiddo I know we have to be careful about confidentiality, but even just about the process alone. Like I know Amanda would just reach out to me, but if Amanda and I didn't have a relationship, then maybe she could reach out to the Region 6 lead, or if it's a licensing question, you know, could reach out to somebody in Amber's shop. So those are just, it's just an example of how that could be helpful. Also, sometimes I think about whatever is equivalent to like a shared planning meeting or a consultation. Those are also places that leads could be available. And I'm careful, I want to say could, because everybody has a different supervisor. And I get into trouble sometimes because, you know, I know that the leads are so invested in this work that they will prioritize it. So Amber, I think I want to toss the question to you as well in terms of thinking about how the licensing leads, or if you have thoughts around any of the leads in terms of how they could help be a resource for the community.
I think about like community members who've come to me around like what changes they want to see in their agency, or how they want to promote trainings, or how they want to have a policy around this. And some of the leads, like you said, Day, kind of depends on structure and who's, you know, the comfort level supervisor, all those things. But they're having those conversations. They're sharing what they're doing. They're sharing what we're doing as an agency. They've also like helped with some of the conversations, like in licensing division specifically, if you're working in regional licensing and you're working with a family and there's some concerns around their ability to support all children, specifically those who identify or may identify as LGBTQIA+ now or in the future, they can help consult with you around like what are some questions that are like case specific that you can ask. In some cases, they're able and willing to sit down with you and the family. I know that's pretty uncommon when it comes to regional licensing, but they're willing to do that and they're open to doing that. And they also can help with some, like, I think I may have already said this, Day, but training resources. So like specific to, I mean, nobody knows like your agency better than you do. Nobody knows this family better than they know themselves, but they also like, they have more knowledge about like what's in their specific community than say like I do as like on the statewide level. Some of them also pass out stickers and things too, which can be fun.
So we're actually just kind of nearing wrap up. I wanted to make sure we had plenty of time for questions if folks were comfortable verbalizing or keeping them coming through Lily, that's okay too. And I just love, you know, there's so many good quotes to love, especially right now. And Lena Waif, you know, to be yourself is truly a revolutionary act. And I think more and more people should try it because it's gotten me a pretty cool life. So how do we do that for our children, youth, and young adults? How do we help them step into the revolutionary act of being themselves and getting them, you know, on whatever track that they are wanting to explore and try and discover and figure out? Because most of us adults know that it takes a while. I mean, it takes a while. And I think I'm still trying to figure myself out, right? And I really just want to keep that idea and that hope and that nourishment at the core of what we're doing. I know policy is just paperwork, right? When I think about the new administrative policy that's coming and how it can impact our children, youth, and young adults, and holding staff accountable to a different way, or giving them a guideline and how we can do the work better. I know that there's a place for policy in this work, right? That's that head work. And then doing the day-to-day work and showing up is that hands work, but it's really our heart work that drives us to keep their emotional and physical safety at the core of everything that we do. And so we're trying to do our part over here at DCYF. I know we're a big government agency and that doesn't always bode well, but we are trying to do our part. And I'm really glad to be partnered with so many of you in this conversation with us. And looking forward to building partnerships with those we haven't had a chance to yet. I think our contact information is next. We can leave this up and we can also drop it in the chat. But also just want to open it up for open Q&A, or if anybody wants to go backwards and have us talk a little bit about more, I'm happy to do that as well. or if I'm going to just put people on the spot a little bit, if any of the DCYF folks on the call want to share some of the work that they're doing in their shops, I'd be open invitation there as well.
Hi, this is Angela Weeks. So I don't know many of you on the call. I know a few of you. Thanks for having me. I do national work, and so I'm really interested in your process because of all the states that I work with, there's always different strategies for getting these initiatives off the ground. And I think it's really innovative that you've put leads in so many different places throughout the regions and offices, and that it seems really promising to me. Many of the states that I work with have leads, but are only in some locations, or maybe there's just one position available that they've tasked with LGBTQ plus initiatives. And sometimes those leads do not have the authority or power to really shift anything on their own. And so I am interested in knowing more about this process for you all, at least, and with the thought in mind that I could potentially share it with some of the states that I'm working with. I'm thinking through things like, how do you select or develop these leads? And also, what is the process for making changes if there is more power or authority that's needed for particular things? How does that process work? So I don't want to take up all the time that potentially Washington folks have questions for you all. I don't want to take up the time, so it could be an email follow-up, but I think those are just things running through my mind right now.
No, absolutely, Angela. It's good to see you and happy to respond to your question. And maybe I'll just I'll attempt to do a high level and we can follow up also. In 2017, I got hired in my 4th position at DCYF, and I was the LGBTQ plus disproportionality commercially sexually exploited children's statewide program manager. Ridiculous title. But the intention of that position was created to do that work, specifically around LGBTQ plus children and youth and child welfare. And that, I think, put in motion a lot of what, the higher ups had been thinking about, which we knew there was a gap there in terms of having some focused attention on doing that work. And from there, I think on day 2, my then boss said, and you have to have a policy out by March, right? Which is 3 months, which is not a long time at all. Fortunately, in huge ways, I had already done some engagement with CCYJ actually, and because there was previous work around the equality pilot that started doing that work. And so some of this work, much of the work inside child welfare has been partnered with a key agency such as CCYJ to move so much of it forward. Now that doesn't get to your leads piece, but what it does get to is like how quickly the work moved and that we knew that there was a gap. There was no way that 1/3 of my statewide program position was going to be able to meet the needs regionally because what Spokane and Omak and Ellensburg and Walla Walla and Bellingham and Olympia all look really different in terms of resources. And it was really critical for me in being in that position to take advantage of my positionality and generate some awareness around that need. And as that grew, we were working closely with licensing. We were still in children's administration at the time. I was able to literally reach across or down the hall at the time to the licensing staff. And so we started doing shared work together. And as this work continued to grow and we turned into DCYF, it was abundantly clear that licensing also needed their own leads in doing this work, and the work looks different there. Now as the Office of Racial Equity and Social Justice, again, I'll just say taking advantage of positionality and bringing this work to the broader agency, there's a critical opportunity for us to do that, and in that platform, able to generate and increase the awareness for the impacts across the agency in doing this work. And for some, it's been an easy buy-in, and for others, they're still struggling. And I just don't have a lot of time for those who are still struggling. And I don't mean that to be unkind, because there's ways I want to bring people along. But if we continue to focus on the folks that are struggling, the pace is we're just not going to get very far. And it doesn't even have to be very fast. We're not going to get very far together. And thinking a lot about our youth and the young people that I work with are helping me set the tone of what we need to do and how we can do it better. So I'm going to share more with you.
Yeah, thank you for that. I don't have my camera on, but I am nodding as you're talking.
You're good.
So I appreciate it so much. Thanks for that answer.
Yeah, of course. And I know you didn't ask this, Angela, but it reminds me to think about too the development of the advisory committee. In part, that was motivated by developing policy, because we always need external stakeholders. Somebody had asked in the chat about bringing youth and young adults into the advisory committee, which we do have. And I would eventually love to co-lead with the youth and young adults and actually have them, dare I say, run the meetings. And I don't mean that as an imposing position. I also won't do that until they are compensated for their time in a way that I'm compensated for mine and that their support needs are being met. So I'm careful around that. But the development of the advisory committee also generated out of a need for how do we do this work better and how do we do it together. And so that the advisory committee, and if you are interested in joining, you're all are welcome just to shoot me an email, and I'm happy to put you on that, invite you to the distribution list. Our leads are on there, other statewide agencies, nonprofits, youth and young adults, and like the Office of Civil Aid. Like there's just such a caregivers, people with lived experience. Like people just keep popping in my head, and it seems to be unfortunately kind of a rare space for people to come together and be cross-system involved. So there are gaps in there. Like any other meeting, right? But we said that we're about 30 people strong and growing in a lot of ways and a lot of representation. So
I also just want to add to Dave that group. I mean, I think that there's one of the biggest things that we hear is like, where are the resources? And it's like, yeah, that's a representation of 30 people, but those folks know folks, right? So if you're in a space where you're like, where are the resources? I highly suggest you come, do a little bit of networking, and I guarantee you will walk out with a list of at least 60 people that you can refer other people to. I mean, I can say that because it's happened for me. So I would highly encourage people to go to those LGBTQ plus advisory group, like commission. Thank you, Dante, for putting that in there too. And like Lavender Rights has folks as well, Black Trans Task Force, like all of these places you can go to and find those resources and build that network. And I just really encourage folks to really take that extra step and do that. Other questions for Day and Amber? I have one question, as always.
okay.
And you know, Day, I think a lot about like policy being translated into practice. And I think a lot about like, especially like young people kind of going through these systems, not always knowing that they have access to like these rights. And, you know, what is, I guess, like one thing that workers should be telling young people, particularly if they're LGBTQ plus in this system, like what is the one thing that you think they should be telling them in regards to like what services they actually have access to, or like what rights they actually have access to?
No, that's a great question, Lily. Sorry, I'm shooing away mosquitoes. Please don't misinterpret that as dismissal. Amber's cracking up at me. The things that come to top of mind is just affirming that they're going to have needs that are unique to them, and that I'm going to say this, but I don't want, again, sounds like we are obligated to meet those needs, right? By our policy, by our WACs, by our RCWs. I think I've heard more times than I care to count how many times a social worker or a caregiver has refused to bring a young person to a resource. I think Gender Odyssey was mentioned in the chat, or Oasis, or, you know, pick your community resource. And for whatever reason, and it's usually the adult's reason for not being able to do that, right? So I want our youth and young adults to know that they have access, and we are obliged to do that, if not by the goodness of your heart, but by the headwork in doing that policy. And that our role is to center that child, youth, or young adult, and having their needs met, inherently providing a sense of affirmation and safety around their development as a young person. And they also have rights to medical resources. I know that, I know Jen Estroff is on the call with us, and is just a fantastic ally, especially with the work we're doing with Apple Health and partnered there. When we rolled out policy and said that young people have access to gender affirming medical services, I got pushback quick around like, we won't do that really though, will we? And I'm like, oh yeah, we will absolutely do that. We will support young people in accessing gender affirming medical services. And what that means for the social worker, you're gonna call Apple Health and they're gonna walk it through with you, right? So it's not extra work because we're doing parallel work together. This is just another great example of what we can do when we reach out and partner together. Is that Apple Health, and Jen, I know you can speak to this better than, but Apple Health and DCYF, we're doing training for staff. We're looking at procedures and practice alongside each other in parallel tracks, so that when we have a young person who is accessing and wanting to explore that option, that they have that mutual support coming inside. It's not oh, they're doing it or they're doing it. We're doing this together to wrap around that young person. And Jen, you unmuted. Did you want to share?
Oh, I just, I mean, we tried to build so first of all, DCYF made sure that Healthcare Authority wrote into the contract that special attention needed to be paid to LGBTQIA+ youth. And that was before we had a whole, policy and like bigger understanding and all of that. And so some of us quite honestly internally had some coverage to say like, okay. And the way we did it was we connected with LGBTQIA health leaders in Seattle, invited them to come in and tell us what should be in our training. And Day was right there in the room with us because she wanted to hear it too. She wanted to see what were the health resources that should be applied, that we should be covering with Medicaid and getting access to, that would roll right back into what youth involved in child welfare would have. So that loop and that partnership has just been really invaluable. And now it's about conversations with the Healthcare Authority for behavioral health. So youth getting behavioral health letters to be able to access gender affirming care. So it's always evolving and getting better, just with new partners in the scene.
Well, great. Thank you all so much. If you have additional follow-up questions, please feel free to send them to me. I'm happy to forward them on to Day, Amber, and also Jen if you have questions about healthcare. With that, that is the conclusion of today's Pride Lunch series. I invite you all to join us next week. We will be hearing from Youth Emergency Services out in Pend Oreille County, and they're going to talk a little bit about the unique unmet needs of rural youth and how to really build community support for those young people and just lessons learned from them. So again, thank you so much, Day and Amber, and thank you all for joining us, and we look forward to seeing you all next week.